Okay, fantastic. Then I will kick us off. Welcome everyone to our Rural Cafe. Very excited for today's session, focusing on knowledge management in rural and frontier local health departments. As a reminder, my name is Victoria Freer. I am the Senior Program Analyst at NACCHO for Rural Health. Very excited to be joined by our colleagues at Deloitte and other team members on the NACCHO team. If we can go ahead to the next slide. Okay, we're gonna kick it off real quick with a couple of NACCHO news and opportunities. So we're very excited to announce that we are creating a rural public health emergency preparedness sort of work group. This is open to any emergency preparedness coordinators and professionals who work in a rural or frontier area, working with this community. And it's really just going to allow members to connect with each other, share best practices, any current situations, challenges, and ask advice from one another, sort of help each other out. If you see this QR code right here, you can go ahead and take a quick snap of that. That is the interest form. At the moment, the first meeting is set to kick off in June. So we would love for you to share this out with your team members or join yourself if you are interested. And then our other opportunity is we, would be remiss not to highlight our NACCHO 360 conference happening in July. This is one of the largest convenings of local health department leaders, public health professionals, and we always invite people to come or join virtually if they can. This really is a great opportunity to learn, network, and share experiences across local health departments. This year, we are very happy to be in Detroit, Michigan. So if you are close by, we, encourage you to participate and attend. The dates are here, July 23rd to the 26th. And again, here's the QR code to take you to the registration page for the conference. We can go on to the next slide. So I'm going to go ahead and turn it over to Amber, who will talk us through today's focus.
All right, thanks so much, Victoria. It's so wonderful to have everyone on the call today. Thanks so much for joining our session. Today, we have the opportunity to connect with and learn from each other through a large group discussion on knowledge management concepts and its application in your health departments. In this session, we will foster effective problem solving and information sharing, understand what methods local health departments have used to fill knowledge gaps, and commit following the session to practices your local health department would like to adopt for your organization. To quickly go over the agenda today, I will highlight who's on the call and introduce our lovely facilitators who will be presenting the content for the discussion. Next, we'll have an icebreaker to get the ball rolling and refamiliarize everyone with Poll Everywhere, the polling tool we'll be using today for today's session. Following that, we will discuss knowledge management concepts to define what knowledge management is and the different components of knowledge management. Then we will share tools that can be used to apply some of these concepts. Following that, as a large group, we will discuss how we can transform learning into action with an application to knowledge management exercise. And then after that, you'll have an opportunity to ask our facilitators questions before we wrap up the call. So I want to highlight our the different people on the call today. First, I'd like to highlight the local health department representatives who make up most of the call. You all will be bringing your wonderful insights to today's discussion. I also want to highlight the NACCHO and Deloitte team who will be facilitating today's discussion. And I also want to welcome CDC's Office of Rural Health representatives who may join our call today to hear your valuable insights. Again, thank you for joining, and I look forward to hearing your unique perspectives. At this time, I'd like to take an opportunity to introduce our Deloitte facilitators. We have Sophia Grimm and Marissa Kessler. Sophia, I'll let you go first.
Thank you, Amber. Hi, everyone. My name is Sophia Grimm. My background's in public health and emergency management. I spent the majority of my career in the public sector. I worked for CDC for 5 years, but they let me out of Atlanta, which is great. So I was field assignee to Wyoming Department of Health for 2 years and North Carolina Department of Health for 3, prior to becoming a local emergency manager, during which was the majority of COVID. So that was fun. Excited to be here with you today and share what I've learned about knowledge management as I've moved through some of these different agencies and been able to support them in some of those knowledge transitions. Marissa, I'll let you go next.
Thanks, Sophia. Good afternoon, everyone. My name is Marissa Kessler, and I've been with Deloitte for about the past 3 years, but prior to that, my career has really spanned a range of expertise in strategic communications and change management, organizational design and development and improvement. And one of the things that I've worked on with several clients is really around how you do things like succession planning and knowledge management. So excited today to share with you all some of what I've learned, particularly working with CDC in the public health space for the last several years. Including currently working on a project with a national center that is investing a lot of time and energy into thinking about how they do knowledge management as they encounter retirements and transitions and people going on details. A lot of what COVID exposed was what happens when people are moving around or need to be quickly reassigned to do certain work, and knowledge management is definitely at the forefront of how you can help with that. So thank you guys for the opportunity to share some of what we've learned with you today. Back to you, Amber.
Thanks, Marissa. So first, I'd like to pause and to go over the rules of the road. I want to emphasize that we'd love for you all to be present in the moment with us. It's always fun when you're actively participating. This is an open forum. Everyone's input is valuable. No one is expected to know everything, not even our facilitators. Please go beyond business as usual and think creatively. Always assume positive intent and give others the benefit of the doubt and ask clarifying questions when you're unsure. So next, I want to reintroduce everyone to Poll Everywhere. We've used it before. As a reminder, you can open your browser on your computer or mobile device and type the link on the screen, pollev.com/NACCHO1. And we also have dropped the link in the chat for easy access. If you're having any troubleshooting needs, please notate it in the chat and we will try to help you. So first, let's practice Poll Everywhere with 2 icebreaker questions. As we discuss knowledge management today, we would first love to know how long each of you have been in public health. There's a wealth of knowledge and experience on this call, and it would be great to learn, what is your tenure in public health? So I see some people are already responding. Give folks a few minutes. There seems to be a wide range of different people on the call today and different tenures in public health. I definitely want to take the time to just really thank everyone for their hard work and dedication in this field, especially during some difficult times we've experienced here in public health. I'll go to the next question. Additionally, we want to know which of the following scenarios is relevant for your health department. You can select more than one option. It helps us to understand your frame of mind joining the session and your knowledge management needs. If none of these scenarios are relevant to you, please select other and feel free to enter in the chat what is relevant for your health department currently. Yes, I do see some people who have selected other, so it'd be, I'd love for you to put in the chat maybe some other scenarios that might be relevant to you as it relates to knowledge management and your knowledge management needs. And we do see quite a few people who have said they are anticipating the retirement of key staff members within the next 2 years. And so that's definitely something that we've heard prior to this session. So we're glad for you to be here. Yeah, someone said funding and loss of critical positions, ongoing training needs for positions that are most effective after 2 years of employment when staff are not staying more than 3. Yes. Expanding programs and filling positions that have been open for 6 months, recruitment for rural areas, overseeing and taking the lead on the Healthy Communities of Florida work plan. Administrator and emergency planner are retiring after this year, funding challenges. Yes, there's a lot of different things that people are experiencing as it relates to the need to knowledge share and manage the knowledge in our local health departments. Yeah. Thanks everyone for sharing. To go ahead and get into the meat of our content, I'll turn it back over to our facilitators to discuss knowledge management concepts.
Thank you, Amber. First, everyone, I want to take a moment to talk about workforce continuity planning and two components of workforce continuity planning, bench planning and knowledge management. A major component of workforce continuity planning is bench planning, and it helps us ensure that our folks have the skills and the abilities that they need to ensure that our essential functions continue to operate with minimal disruption. And when we think about bench planning, it's not necessarily like, how do we just bring people up and promote them, but it's also, you know, who can backfill temporarily while someone's on maternity leave, or, you know, someone's left and we need an interim. Can we do a lateral transition? And it's also a great opportunity for those folks to stretch, and maybe they do want to become a department director in the future, and so it gives them an opportunity to like supervise other people, other teams, see what that dynamic looks like. It's also asking supervisors to look at what the work their staff is doing and at a more critical level and say, okay, can I coach someone who's brand new to the team and doing this work? Can I do the work if this position is vacated? And really, again, thinking critically, not just about like, how do we train staff up, because that's also critical, but also how do we train across the board so that folks can move laterally, as well as like support the folks underneath them, support the positions underneath them. The other component of workforce continuity planning is knowledge management, and this is where we're going to focus the majority of our time today. And knowledge management is the process of sharing and transitioning that essential information smoothly. In the context of workforce continuity planning, it's what tasks, what partners, what processes, what challenges, what lessons learned have we gained over the time in our position, and experiences outside of the position that would enable our success. And so how do we transfer that? How do we codify that? And so there's a couple of different ways we can go about it, which we'll discuss today. But first, I want to define knowledge management. Next slide. Knowledge management refers to the process of enhancing a company's performance by designing and implementing tools, processes, systems, structures, and a culture that improves the creation, sharing, and use of knowledge. Right? That's a very dense definition. So we are going to break it out into two components for you. Next slide. So knowledge management, we can really think about in terms of tacit knowledge and explicit knowledge. Tacit knowledge is that implied knowledge, that combination of skills and abilities that you've gained over a lifetime. And it's really hard to articulate tacit knowledge. And so some ways we do that is through communities of practice, like what we're on today, storytelling, creating space for people to articulate ideas and thoughts and experiences they've had in the past that are relevant, shadowing, mentoring, peer-to-peer exchanges, and stretch assignments. And we'll talk a little bit more in detail about each of these in a bit. Explicit knowledge is written largely, and it's easy to document. You can hand it off to someone and they can read it and they're like, I understand your policy. I understand this procedure. It also comes in the form of like knowledge management libraries, knowledge dictionaries, handbooks, data sheets, timelines. It's just kind of a tangible resource that you can pass along to someone. Next slide. So I'm going to talk about tacit knowledge specifically, and then I'm going to hand it over to Marissa to talk about explicit knowledge. And to kick off our conversation about tacit knowledge, I'm going to share a story with you. So I am in the EOC during COVID, like many of you. And maybe you've had this experience where the incident commander literally is like running by your desk and they're like, hey, Sophia, I need the survey to go out to all of our partners. I need it done by the end of the day. I want you to use this specific tool. Generally, I want you to talk about or ask about like these things. And I say, okay, yeah, absolutely. And in my head, I'm going, why did she tell me to use this tool, the survey tool, that we haven't been using this entire response, right? And my team is already familiar with this other tool. It's like the user interface is much better. And I'm like, this is weird, but I know this person, right? I've worked with her for 2 years, and I know that she's generally the type of person to say, here's your goal, go forth, do good, don't make anyone mad in the process, and doesn't provide a lot of detail unless it's needed. And so I go up to her, I track her down, and literally track her down, right? She's all over the place. And I say, hey, is there a reason you want us to use this? We were thinking about using this other tool, and explain my reasoning. And she goes, no, we can't use that because we've got at least 5 partners that can't even open that type of survey, right? So I'm thinking of it from what's the usability of this survey, and she's coming at it from the perspective of they can't even open it, right? And I bring all of this up to emphasize that tacit knowledge is inherent. It's personal. Again, it's built off of those experiences that you've gained throughout your lifetime. She knew that 5 partners were not going to even be able to access that. That wasn't written down anywhere. There was nowhere for us to find that. I knew, because I had worked with her long enough to ask that, like, why are we going this route, and get more context. Because my team was just like, well, this doesn't make any sense, right? Like, this isn't the tool that we use. We like have to track down the login information for this other thing. And I could have told you, if someone gives you explicit instructions, follow those instructions, right? But that wouldn't have given you the context that you needed to be successful, right? That wouldn't have helped you problem solve the situation. And so, again, this information, this tacit information, it's transferred through socialization, it's transferred through conversations, it's transferred through storytelling. It helps with that critical decision making. Again, like, which way do we pivot? Again, this is COVID. We're trying to get things done quickly. We're trying to do it more efficiently. And if I had just told you, follow the instructions, you would have been like, well, this is so counter to like the whole situation, right? Like, and so it's interesting because it's also embedded in practice, right? Like the practice of internally surveying people and like working with certain stakeholders versus others, it just looks different. All right, let's go to the next one. So I want to spend some time talking about how tacit knowledge can be shared and how it's applied in our lives. So we talked a little bit about problem solving, right, in that previous story, along with information sharing, but it can also be used to share experiences or seek experiences, like share advice on drafting after action reports or share advice on creating a train the trainer for the teachers that I'm going to work with. I've never done this before. What's your process like? Reusing assets. We were sharing a draft report template with you. That draft report is explicit knowledge. But when you start asking questions like, how was this received? What was really effective about this template? What would you change to be like more impactful to the audience that you're working with? That's where you start to get to that tacit knowledge. Coordination and strategy. Let's work together to brainstorm how to approach leadership with this request. I don't know if any of you have gone in front of a board of directors and not been briefed on their personalities, but man, I got to tell you, it's rough, right? You've got the one that's the devil's advocate. You've got the one that has like really intense interest in your topic and has a lot of detailed questions about what's going on. And if you're not prepared to answer those questions in depth, it's not going to go super well. And so having that person to brief you on the side and say, here are the personalities in the room that you're going to be managing is so critical, right? It's not written down anywhere. Growing confidence. What are you excited to share with your colleagues about this training, right? It's not always the old guard mentoring the new guard. It can be the new guard, you know, standing up and saying like, oh, here's what I learned. It's so exciting. And like, here's how I want to use this experience in the work that I'm doing. Discussing development. What do you think of the shared tool? What else would be helpful to you? Documenting processes. We've run into this issue before. Let's refer to these shared resources. And again, shared resources, explicit knowledge, written down, ready to go. But the fact that this person knows that this issue has happened before, that's tacit. They know where to go to pull those resources. That's tacit. Identifying knowledge gaps. Who has expertise in this area? Maybe that's not written down, but they've got the community connections to get you to the right person. Okay, next slide. So let's talk about some approaches. We've talked about how tacit knowledge can be used, but let's talk about how we can start to implement it in our lives. And I think the first I want to emphasize is storytelling, right? Creating that space in your meetings to have meaningful conversations about challenges that you're experiencing and how they're relevant to experiences you've had in the past. It's truly enriching for the people in the room. I'm not talking about creating space to talk about your dog playing Frisbee yesterday, but like truly like content specific storytelling. Provide descriptive feedback on work products in a non-judgmental way, right? Rather than providing track change edits to a document, maybe you add a comment with your track changes that says, hey, like we want to make sure that it's really clear that our community partners made this decision, not us. And providing that like tangible feedback of like why the change is being made. Implement mentorship or coaching programs. I feel really strongly that while your boss can be your coach and can be your mentor, it's also important to have mentors outside of your direct chain of command. What if you are considering leaving your position and you need some coaching on how to transition into the next role? Or maybe it's another position within the health department and you're just not totally ready to like say it out loud to your chain of command. Or maybe you're having a challenge with a coworker and you're not sure how to approach your boss about it and need to do some role playing around like, how do I bring this up to them? Allow team members to shadow one another. And I'm not talking about like sit over someone's shoulder and like watch them at a computer. I'm talking about like, hey, I have to do this community engagement and listening session and I've never done it before. And there's another person who's about to do one in a different program. I'm asking, can I help you prepare the material and take notes during the session to like support you and watch you as you facilitate? And then on the flip side, do you mind like helping me prepare for mine and being there and maybe like even jumping in if needed or I get stuck, but really being an observer as I like move and like develop my skills and abilities in this area, right? So this tangible, productive work that your teams can cross-train in. Offer job rotations among lateral staff. It's a really great opportunity for folks to stretch and to learn. Maybe you've got an FB in one program, you want to like have them work in another, or you've got a manager who's out on maternity leave and you want to like have them backfilled by another manager who again is maybe looking to become a director or a senior leader in the organization. Encourage peer-to-peer collaboration. This is a little bit different than job shadowing. An example might be, hey, I just finished a PowerPoint presentation. I need someone to copy edit it. Look at it from the perspective of like, does the flow make sense before I present it, right? It gives another team member on another program exposure to what you're working on, and also an opportunity for them to provide like critical feedback on a peer's work. Encourage cross-departmental work groups. These can also be called stretch assignments. I would argue that any response is also a stretch assignment because you're working together towards a common goal, right? You're bringing a bunch of diverse people from a variety of areas and putting them together and saying, like, let's work on this together. Lunch and learns, again, opportunity to spotlight an initiative, a program, bring people together to celebrate the good work that's happening in your health department, to let them be your champions in the community. All right, that's enough of me talking. We can go to the next slide. And we're going, I believe we're supposed to have a poll. Interesting. All right, well, folks, I'm gonna ask you to put in the chat, what methods or initiatives has your health department used to share tacit knowledge? Again, what methods or initiatives has your health department used to share tacit knowledge? Strategy meetings, team meetings, shadowings, work groups, department rotations. Love that. Shadowing, emails and staff meetings, round robins. I love all the job shadowing that's happening, short retreats, staff meetings. I hope those staff meetings include that storytelling time, right? One thing you can also do if you're transitioning out of your role is record a video for your successor and say, you know, here's some things that you might encounter in your new position, or like, here's the dynamic of the community. Here are some critical partners that you'll be working with, and here's like our historical presence with that partner. Event collaboration, cross-jurisdictional relationship with neighboring counties. Love that. Yeah, I mean, sometimes you don't have a supervisor who can support you in like learning and developing in this new role. You might have to reach across your county and say, hey, here in the same position, how do you do your work? How is this operating in your area? All right, I'm going to turn it over to Marissa to walk us through explicit knowledge.
Thanks, Sophia. All right, so let's switch gears and talk a bit about explicit knowledge. Now, explicit knowledge management, Sophia gave us a little bit of a rundown, but we'll get to a nice, concise definition here as well. So, you know, we've hinted at previously that explicit knowledge management systems are really going to be the ways you organize this explicit knowledge. So you probably feel like you've got a fair amount of explicit knowledge that you've captured in your organization. We have found in our experience that public health organizations do an excellent job of gathering things like SOPs, guidelines. You probably have some databases, certainly reports, maybe some manuals. But the explicit knowledge management system is really where you take it to the next level, because really the goal and intent behind all your documenting that you're doing is the reuse of your explicit knowledge by capturing, codifying, classifying, and making available the knowledge to support routine problem solving. Simply put, you can have all the knowledge, but if it's not somewhere accessible, and if it's not organized in an accessible fashion, then you're sort of just like, you know, the dragon hoarding the gold, right? You've got all the information, but no one else has access to it. So a big piece of explicit knowledge management is really how you make sure that the knowledge is getting out there as well. So, you know, if knowledge is captured but inaccessible, end of the day, right? What was the point? So let's take a look, therefore, at the concept of knowledge management libraries. So we're going to talk about two approaches today. We're going to talk about knowledge management libraries, and then we're going to talk about mapping, which we call a knowledge directory. So the term knowledge management library and document management systems, they're kind of, you know, used in a variety of contexts. You probably hear them being talked about in software land. And there are a lot of different organizations who've put out products that are meant to help you facilitate this. And you're seeing some of those listed on the screen here. As a public health organization, you likely have to retain some hard copies as well. There's probably some policy around certain things, but explicit knowledge also needs to be stored electronically, because sometimes those hard copy files or documents of record that you're following a policy protocol on, it's not the same thing as how you're going to create a space where information is accessible to your people broadly, and in a way that makes sense logically for them. As we all know, sometimes those retention policies aren't the most logical. So it can help to visualize electronic knowledge management libraries as filing cabinets, right? That's kind of what we're used to thinking about, is filing cabinets. And how are you organizing your files, and where are things? Same thought process you'd use with hard copy, but just shift your gears a bit to be thinking about it virtually. And so let's talk about some of the common features that you'll see in knowledge management libraries. You want to be able to store documents. You want to be able to search. I think this one's really important, how you are able to search, because again, the rules that someone else wrote around logic might not be the way your brain works, even if they did some testing on it. So it's got to be searchable. You also want to be able to restrict certain things. You want to use a tool that allows you to have some restricted files or restricted folders, because not everything is meant for everyone. And you should also be able to monitor who is viewing and when. That's not big brothery. It's more so, it'll give you two pieces of information. What's commonly being accessed might help you understand what you want to keep maintaining, and how regularly you need to go into it. But it's also going to give you a little bit of a paper trail if something goes sideways. If a version control issue happens or something, it's good to be able to know, when was the last time this looked the way we wanted it to? Can we duplicate, revert, all those things? Certainly, you also, with a knowledge management library, want to be able to track the editing to documents for the same reason we just talked about. It's good to have version control, and you want to be able to retrieve. And then you want to be able to control and regulate when you can outdate things. When are things getting archived? When are things being put back on the, sort of back shelf? And how are you organizing that? And then also in today's world, ideally, this is all accessible on a mobile device. It's ideal that you'd be able to not have to be locked at your screen, your biggest screen in the house or in the office, to do this. So instead, want to be thinking about mobile. But regardless of what system or software you're utilizing, it needs to, there need to be rules. There needs to be guidance that everyone is aware of around the creating, the storing, the sharing, the revising in an organized manner. You don't want this to be haphazard. You want there to be some logic around what you're doing. So with that in mind, let's take a look at the kind of rules of the road, the guidance that might help you think about this in sort of 4 steps. So first of all, it's, again, we were talking about this as a filing cabinet. What you're seeing on the screen, we're all very familiar with, but think about, what your root file might be, and then what your subfolders might be.
How to get your projects completed properly.
So if you want to start with thinking about your root file and your subfiles, it's a great place to just take a beat and say, okay, how would I do this? And again, it's not going to be the same for every organization, but a common scenario might be that you would start with maybe a division name or an organization name, and then go down to its sub-organizations, and then maybe down to programs therein. But maybe your programs cross divisions or cross units. So maybe you instead would organize by year, and then you'd organize by program. But maybe in your organization, you'd rather have program and then years therein. There is no one right way to do this. The right way is what makes sense to you, and the right way is what makes sense to your organization. So what will help, regardless of how you organize, is simple and effective file naming. We're all big fans of having the year in there. I'm a big fan personally of doing that backwards year numbering. So you get the year first, then the month, then the day, and then my file name. You'll find all my files like that, so that they organize by date. In a worst case scenario, even if someone can't follow my logic on a name of a file, if they know it was September of 2020, they can go and find my September 2020 files very easily, because they're always going to be searchable as 2020_09 in my files. So just think about those simple descriptive file names, so that things don't get too long and drawn out as you're able to organize and you're able to hit the ascending or descending that you need to get in there. You also, ideally, again, this is a different thing these days, but saving a file in the right place, the right time is going to decrease duplication, but it's also going to decrease links breaking, right? We were just talking about mobile. One of the big changes we've seen is you used to be able to move stuff on your own. And it didn't really matter because if you reorganized your files, you were always hard copy attaching things, right? We don't really do that so much anymore unless we're sending something out. Most of us are accustomed to sending something that is a clickable, shareable link. So if you move something from file A to file B, your link that you sent to someone is now broken. So that always incentivizes me to be thoughtful about, am I putting this in the right place the first time so that I don't have to go back to 50 people and say, here's a new link to that file that I, shared with you before, but we've moved it. This stuff happens and it's fine, but being thoughtful about it and trying to get in front of it in today's more shareable file world is a good hot take. We also want to think about these document libraries get really big really quickly, right? So how are you culling files and how are you looking at documents regularly to say what can go into the archive or what no longer makes sense? What you might have to retain something due to, again, policy or maybe even regulation, but can you make use of an archive file or anything like that? I always think about with this, my dad is a dentist, and so he deals with OSHA and he deals with HIPAA. And with HIPAA in particular, they changed in the course of his very long career your file retention. So he has to keep files for patients for a very long time from the last time he's seen them. So he used to have hard copy files, and there were these boxes in our attic that were dated with when he'd be able to get rid of them. But when he went electronic, it actually got way easier because he had these last date year files, and he could just move people in and prepare year over year to clean out his files a lot more easily than when we used to drive to a secure document facility to have old patient records shredded. So you can tell I had a unique childhood doing those types of things. But when you think about it, that's really what you want to have in mind. If you imagine that you still have a hard copy filing cabinet, eventually those things always fill up. And that is when you would usually cull it out. Electronically, you're not going to hit a full point. So instead, I like to think about just what's the kind of spring cleaning, what's my cycle of going in and moving that stuff out so that there is space in the filing cabinet, even though it's an electronic endless filing cabinet. I don't want to think about it that way. I still want to think about what makes sense to have in there at one time, because that's also how people will find what they need to more easily if it's not all clogged up and jammed up. Okay, so let's talk about kind of the accompanying piece of this, which is a knowledge directory or knowledge dictionary, which is about kind of this space that straddles what Sophia was speaking about and what we're talking about with explicit. And that's thinking about the mapping of each employee's areas of expertise kind of through that lens of who in the organization knows what. And so the knowledge that they have is the tacit knowledge, but documenting that mapping, knowing who holds the key to the information, that you can put down in a more explicit fashion. And so we think of this as gateways to knowledge, right? So the knowledge could be tacit, the knowledge could be explicit that someone has, but the putting it down on paper, that's definitely explicit. The putting it down somewhere where you can know, even if you're new to the organization, I go to Sophia for that, I go to Sarah for that. That's something you can put down and help people have a roadmap to your organization and how to navigate the complexities of what's in everybody's brain. So you might want to consider mapping out existing expertise within your organization to identify knowledge holders. So that might be conducting interviews, identifying subject matter experts, and writing that down. This is also about some of the things we were hearing in the chat, where you talk about things in meetings and you peer-to-peer share and you do these things where you're having diverse experiences. How do you use those to build and co-share knowledge about who knows what and then write it down? Connect your junior staff to people for mentorship opportunities and see what they can do about, again, putting these things on paper and passing that knowledge forward to the next generation of people who come into these roles. And then identify potential knowledge gaps and focus on filling those gaps. Having this type of think through process will often tell you, where the information is missing. One thing that I do not want to let this moment pass by on saying is, I think one of the hardest things about this is that in an ideal world, this would be person agnostic, right? You'd be writing down, you wouldn't be writing down Sophia knows this. You'd be writing an epi in this program knows this. But we all know information is more fluid than that, and that people move around within organizations and you often take your knowledge with you. So I think that's another way to think about it is, if a person in role X really should know this, how do you think about getting this to a more person agnostic space? You're probably not going to get there 100%, but doing this type of mapping can often help you understand logically, where do people expect to be able to go get an answer versus the answer traveled with a person all over the organization. And so I had to go all over the organization instead of where it logically might have lived. So that's a good kind of longer term aspiration, is thinking about how you get this to a little bit more of something that's tied to a role instead of a person. Okay. Phew. A lot of information. All right, so let's finish up this section before we do some conversation with thinking about some of these considerations similar to the approaches that Sophia went over for tacit. We want to do the same thing here and think about some of the very tactical components with regards to explicit. So where does the knowledge originate? You want to think about the source of the information. Is it internal? Is it external? That's a really important piece of the explicit knowledge management. Is the knowledge centralized or distributed? Does it need to all be collected in one place, or is it naturally distributed? I think of this one as like a gold star item. This is a really important one because, again, maybe right now it's all distributed, but maybe through an exercise like this, you're able to figure out where to prioritize some consolidation. For the same reason that we don't want to follow someone all over the organization, we probably don't want to go to 6 departments to get answers on one thing. Ideally, we bring it all together and start to consolidate some of these things. Another gold star one, how do people stay up to date on the knowledge base? So, are you giving people information on how to use your knowledge repository? What are the expectations around sort of self-guidance? And really getting in there and making changes or being part of the solution that you're building. What's the format of the knowledge, right? Documents, toolkits, Q&As. I mean, there are so many ways you can go about this. Again, making things readable and easy to follow is really helpful. I'm a big believer in even having some guidance on what becomes what type of knowledge. So sometimes in my folders, you might find an upfront, item that tells you, here's what you can expect in a document that's a Q&A. Here's what you can expect in a program debrief. Here's what you can expect in a hot wash document. So someone can maybe go and have an easier time, again, if they're searching, especially knowing what to search for. Again, here we go back to searching. Can knowledge be searched or browsed? I mean, the answer to me on this one should always be yes, but the goal is to make it as efficient as possible. But with most of these tools, even if you have a little bit of a hiccup, the search capability is probably going to be your savior for people to find what they're looking for. How would the knowledge be used? So defining clear purpose for knowledge usage is really important, because that's going to help you, I think, especially with the decision criteria around what goes into the knowledge management system versus what can be left out. And also, what do you keep versus archive at certain points? So at some point you might be like, I don't need a Q&A on this anymore. I now need a Q&A on this. And so you want to cycle through some of that. What tools are going to be viable for you? This is really important. Low cost and no cost tools are out there. So cost shouldn't be a barrier to this. A lot of times, we think that like the fanciest, most expensive thing on the market is the best thing. I would argue that the best thing is the thing that is the tool that and you know how to navigate, at least as a starting point for knowledge management. Working in a tool you're familiar with and getting people kind of upskilled on that is a great way to start. And then if there are gaps, fill them in and think about, what you do as you get more sophisticated. And then lastly, does the tool create any barriers for access to staff? You want to identify those up front. So what's the usability? Is it easy? Again, navigation is an important one. If you are interacting a lot with individuals outside your organization, while all of that knowledge might not be able to get out there, can you share what you need to share with them efficiently? Or is this creating a barrier? Is the knowledge management system itself creating a barrier to what you want to achieve? So we could go on and on about this. There are many more considerations and individual scenarios we could unpack. But this is a great, I think, starting list of things to have in your mind as you think about launching something like this and moving it forward. So with that, I know we're going to try and do some polling. But if it's not working, then oh, perfect. Yes, the polling is back. Thank you guys. Awesome. So our first poll EV item for you, if you can go back to poll everywhere, is how does your health department maintain explicit knowledge? So again, think about manuals, Q&As, hot washes, maybe one-pagers, informational items. So any and all of those things, how are you all currently maintaining those explicit knowledge items? Job aids, that's a great one. And you see the stars. So if someone says something you like, you can upload it. SharePoint, intranet, yes, yes. We love all of this. A very unorganized shared drive. Oh gosh, we feel that. We feel that in our souls, all of us. Manuals and shared, so lots of shared files. That's to be expected. Great. And I'm seeing some items in the chat. And I want to thank you for this one about sometimes the search capability is tricky, especially in SharePoint. Does anyone have a resource that they found helpful in learning how to make SharePoint sites and libraries and how the search function across those different components? So if anyone has help for Anna, definitely pop that into the chat or maybe direct message her. But yeah, SharePoint is, I mean, again, all these tools are great and all of them you'll find some sticking points and you'll find some things you have to kind of work through and around. And again, I'm going to go back to Sophia and the tacit. There will probably be someone who solved it and it's not written down somewhere. So when you solve it, try to write it down somewhere, try to give people that roadmap so they know what to do the next time. Okay, great. This is great, guys. We'll give everyone a few more seconds. Lots of paper files that are difficult to search. We got to get you online. We got to get you a Google Drive. Several shared drives. This one resonates for me. This happens a lot, right? It was several shared drives where you have the right tool, but it's the distribution model we were talking about. How do you potentially bring it back together? Task sheets, again, sometimes excellent, sometimes overly manual, or again, might be only on one person's computer. So, okay, this is really helpful. Let's go ahead and take a pause here. And we've got one more poll everywhere in this section. So we'll give that a second to load, which is about addressing and filling knowledge gaps. So what strategies does your health department employ to address and fill knowledge gaps? So you have figured out that you have a knowledge gap. What strategies are you using to help fill in the blanks there? People everywhere says to hang tight because y'all are typing. Contacting partners and regional neighbors, great. Training with a neighbor, yes. Lots of educating through seminars, asking similar counties. Hot washes, individual research, communities of practice, love that. Staff training, lunch and learns. Oh, a performance management software, adding that to the mix, great. More trainings, yes. Great. So one thing I find interesting is a lot of these are, reaching out to people, reaching out to partners, trusted entities. And in doing that, again, I'm going to challenge you. What are you doing with the information afterwards? Because you might be picking up that tacit knowledge, but what are you doing to convert it to explicit? So maybe that gap gets more permanently closed or gets more permanently addressed. I think for a lot of people, that's kind of the switch that happens in the brain as they think through a lot of this is thinking about, okay, I know how to go out and get the information, but then what are you doing with it? Because you don't want to just take that information with you. You want to find a way to disseminate that information, either through your organization if it's an immediate need, or to share it so that you're leaving the role healthier and more whole, when you go to the next adventure for yourself. So this is great, guys. Thank you so much. And I'm going to hand it back to Amber as we keep going.
Great, thanks so much, Marissa. So now we want to provide an overview of the resources we distributed prior to the Rural Cafe session. And if you did not receive that, it should have been attached to the invitation. But when we share out the recording along with this slide deck, we'll also make sure we share out the tools again if you did not receive them. The first tool that we'd like to highlight is the Leadership Transition Guide. And at the beginning of this call, a lot of you mentioned the anticipation of key staff members retiring. So this is definitely a document for those staff members who are planning to retire soon and maybe need to kind of document a lot of the knowledge and things that they have and things to consider when someone is filling their role. So the Leadership Transition Guide is a comprehensive document that features 4 activities designed to facilitate the process for refining position descriptions, documenting skills and experiences, sharing development strategies to bridge talent gap. This is ideal for the staff member planning to transition out of their role in the near future, like I said. And to kind of just break down the different activities in this particular guide. In activity 1, you would share your information on the individuals who's directing, who's planning to transition, or you would also share growth opportunities in this section, future plans to help your organization prepare for your departure. In activity 2, staff members can summarize aspects of their roles, such as responsibilities, duties, and projects. They can also define how their role may evolve in the future to help ensure the position, description, and knowledge, skills, and abilities are accurately reflected in the role that's going to be posted. In activity 3, staff members can document the needed skills, experiences, and trainings for the position. They can lay out their previous roles to highlight career progression options to assume the role. And then the last activity, activity 4, staff members define the skills and abilities needed for potential candidates. They also help identify gaps in the workforce talent pool and share development and training strategies to help current employees prepare for those roles. So that's the Leadership Transition Guide. The next one is the Process Summary Template. The Process Summary Template is a tool to document key information and insights after a reoccurring process has been completed. And we do encourage that the template is filled out within 60 days of completing the process when key details and insights are fresh on your mind. This documentation is intended to assist individuals completing the process in the future and to inform potential improvements. And all sections of this can be completed by the individual responsible for conducting the process. So for example, someone managing a grant would be responsible for documenting the process for submitting a grant deliverable. A data analyst or evaluator might outline the process for pulling and cleaning data for reoccurring reports. An event coordinator could also use this document to share the process for coordinating with community partners for special events. And of course, that's just a few examples of how this document can be utilized, but there are so many different things that you can capture with this process summary template. And then the last tool that we'd like to share is the Knowledge Management Strategy Plan template. And in this tool, this helps facilitators engage their teams to identify knowledge management strategies and action steps to support the initiatives that you'd like to implement in your local health departments. And so there's 2 activities. In the first activity, facilitators can help team members think about knowledge management strategies that they want to either stop, start, or continue. So what are the things that you like to implement? What are some things that maybe you're doing that isn't really assisting your knowledge management or knowledge sharing? And what are some things that maybe you're doing that you'd like to continue to do and to progress with that specific activity? In the second activity, the facilitator helps the team to identify actions they can take in the next 30, 60, or 90 days to support their knowledge management aspirations, as well as define the owner of those actions. Now, obviously, you can change the time frame. It doesn't necessarily have to be 30, 60, or 90 days, but it kind of gives you an idea of some of the things that you can, actions you can give time frames to. And this activity is perfect for team members during a workshop, huddle meeting, or brainstorming session. And we do provide instructions on how to implement these activities, either in person or virtually. So to give you an overview of how to implement the strategy plan tool, I'll go to the next slide, and you're able to complete another poll everywhere question. And this time it's a survey with 3 different questions. 1, what initiatives can you implement in your health department to improve knowledge management? 2, what's like one action step that you can take to fulfill this initiative? And 3, who would be the owner of the action? If it's you, what's your role? If it's someone else, what's their role? And how would you define what action they would take and who would be responsible for it? So I'll give everybody a few minutes to complete that survey before I transition over to Marissa to kind of go over your responses. A few surveys underway. And if you're having any issues, please just let us know. You can always come off mute as well if you want to share anything, any stories you have related to your knowledge management.
So how do I get to the survey then?
If you see the screen, you can go to pollev.com/NACCHO1, or you can also take your mobile device and scan this QR code in the corner. It's the same link that we've been using for the other questions. It should automatically upload the next question to answer.
And Charlotte just re-upped it in the chat. So if you go to the last item in the chat, you can also click directly from there. Thank you, Charlotte.
Oops. So I'll go to the next slide. There's quite a few that are complete now, so we can see what your responses are, but feel free to continue to complete it as we go along.
Let's take a look at how we're looking.
So mine says content missing.
Oh no. Deborah, you can also pop stuff in the chat. It looks like Rhonda's maybe having an issue as well with the poll EV. So feel free to pop things in the chat as well if you want to share or come off mute. As Amber said, we're happy to have people join us, chatting through some of this. Thank you, Charlotte. Charlotte's going to put the prompts in the chat, so feel free to respond directly in there. And of course, we'll capture all that good information on the back end of the call. But in terms of knowledge management initiatives that you or your team can implement, we're hearing mentorship opportunities, COOP plans, that's a great one. Upgrading Microsoft to an updated version that's able to use SharePoint or something similar. Yeah, if your Office is really outdated, Microsoft Office is really outdated, definitely that's a fast and quick win to be able to get more in there. Amber, what else do we have if we scroll down a bit on that? Are you in control of the see more?
Oh, yep, hold on.
Yeah, better files, reorganizing the share drive, leadership transition guide, nice. This is great. So let's maybe go ahead to our next question, give folks a preview of what's coming in. Because I know we want to have time for some open Q&A as well, but name one action that you could help accomplish the knowledge management initiative you identified. So some of the things you all said, and then how might you make them happen? Look for grants to support upgrades, making sure new hires have the things they need to start off successfully. Yeah, talking in your monthly leadership meetings. Sometimes it's as simple as that, right? Awareness, and then starting to build some advocacy and momentum around the changes you want to see. Scheduling more cross-departmental opportunities. Yes, definitely. Polling employees to compare. Yes, this is a great one. This is something we did with the client I'm with now, where we were looking at what's already in place and how do we take the best of and bring that together, which has also minimized disruptions with rolling things out, because a little piece of things, if it's something you're already doing, that lowers the barrier to access and also just that mental load of doing the work. This is great. Awesome. And then let's take a look at that third question right quick and just get a preview of that as well. So who will own your action? Program leads. That's great. That's great. Someone says me, I'm going to do it. Great. The business manager, you need supervisors, HR. Yeah. Potentially supervisors to help with things, health educator. Okay, great. Yeah, so I think one thing that's interesting about knowledge management is at the end of the day, we can all take these micro actions and that's what drives it forward. But we also cannot do it alone. So having a sense that you're willing to take ownership of something, but then also who else do you need to come on the journey with you? Really, really important. Yeah, Meredith says it in here. We are all responsible for our parts. It's a great way of looking at it in the chat right there. If you guys haven't spotted that, that's the long and the short of it. The more people you have who are doing knowledge management the way that you want to do knowledge management, the better the overall impact is going to be. So please keep submitting your items in the chat and I'll pull everywhere. But Amber, is it time for Q&A? Is that going to be our next step?
Yes, so now we can open up the discussion for any questions you may have for us. Feel free to come off mute or enter your questions in the chat. Looks like Roberta has her hand up. Go ahead, Roberta.
Hey, this has been fantastic and really has gotten me thinking, when Sophia, when you were talking about the tacit knowledge, the first thing that came to my mind is, sometimes, we go off experience, but maybe those experiences weren't so good. And so, I've got a staff member that's really excited to get engaged and do some policy stuff. And then I'm like, oh, wait, like during the pandemic, this happened with that partner. And so, what are some strategies to kind of get over some of that like negative reaction, maybe with some of your tacit knowledge and maybe be open, I guess, to other thoughts and ideas?
Yeah, that's a really good question, Roberta. I think always sharing the background with your employees is important. And also helping them understand that like that is not their load to carry, right? Like they get to enter into that relationship as like a fresh, new face, new person who's curious to learn, who is now more informed about like, maybe I shouldn't ask about this thing because it's a little bit sensitive for them, or like, let's focus on the future. How can we accomplish this together? And so it's always difficult where you're like, I feel like I'm airing our dirty laundry, but in reality, I think you can ground it in like, hey, I want you to be successful in this conversation, so I'm going to help. I'm going to let you in on some information about like challenges that we experienced with this partner in the past, so that you can work on mitigating them. Maybe it's something simple as like how we communicate that can be modified going forward.
I want to build on what Sophia is saying to say that this is why I think sometimes that like tacit to explicit conversion is really helpful with that, because I think there's what you are willing to say in a room across from someone versus what you'd be willing to put on a file that lives on forever. So sometimes encouraging someone who had a negative or challenging experience to write down their hot wash or kind of write down their like, their partnership management for this person or this entity. By doing that, they're inherently going to have to find not like silver linings per se, but they're going to have to force themselves to write it in a way where you learn from it, but it's just not so emotionally charged or so chemically charged. And so I think that can be really helpful too, is to say to someone, while the emotion is still there, like put this on paper so we don't lose the reality, but it's got to be, but also like go back and keep reworking that until it arrives at a point where it really would help someone. It's almost like a therapy exercise for them, but it also, I think that conversion is a really good thing. You don't want to lose you never want to lose the piece of that conversation and storytelling that's additive, but also by asking them to write it down, that might take down their temperature a bit as well.
I think we also have a few questions in the chat. Mary Beth asks, she would love to see an actual map of knowledge. So if I was a new employee at your organization, Where would I look to find who I need to reach out to? Any thoughts?
I mean, I think that's going to be organization specific as to where that would live. And it kind of goes back to that, who's going to sponsor and champion that information. So it's going to be something that if your organizations don't have it, maybe you're going out of this call and saying to someone, we should do this exercise. We should figure out how we get that web sketched out and at least give people a starting point to something like that. And again, the starting point can be you. It doesn't have to be with anyone else. It can start with you and your needs. And then you model for others what behaviors and tools they might want to develop as well.
Yeah, I'll build off of that. I did an exercise while I was at the county where this is kind of fun. We all had little cutouts of our faces, and this was specific to emergency management. And so we had all of these emergency management topics, and we went through and we labeled on the board like what we considered ourselves to be like an expert in or like intermediate at. And then also on another board, like what are we interested in learning? And so that you could do kind of that like pairing of like who's the expert and who like wants to learn that skill set. And again, very specific to emergency management, which is why Marissa is saying like you'll kind of have to determine what those competencies are within your health department. And I think Excel is a totally appropriate way to like manage that. Like here's the information. Here's the person that's an expert. Here's the person that wants to learn about it. Here's like kind of the intermediate folks. And I love Charlotte's point. Like this is a great example of what to put on a 30, 60, 90-day plan, one of the templates that we provided for this presentation.
Yes, I'm looking forward to people being able to utilize those tools. We had one other question from Hannah, who says that her agency struggle isn't much with leadership or employees that do not want to use software update documents. I guess it's the IT. Is it the IT department is very hesitant to use any cloud-based software? Any recommendations for convincing them that it's needed, and also a safe way to store documents?
Yeah, I mean, that's tough. I would say if your leadership and your employees are on board, try and figure out who your decision maker is from that, from your IS or IT department, and go at it from a change management perspective. What are the incentives for them? What are the things that get them on board? Maybe there's a peer county to yours, someone similar in size, someone similar in budget, who you could come with a couple of case studies and say they're doing it and look at all these efficiencies that they've realized as a result of it. And certainly there's power in numbers. Like there's power in both the numbers of your leaders and employees who are going to them as a concerted group, as a concerned group, and saying we need to turn this direction in order to do our jobs the best that we can and in order to fulfill our mission to the best of our abilities. And there's power in the numbers that you can likely present to individuals who hopefully respond to logic, that if there are peer organizations who are doing this well, who made the switch, who can maybe help them see what the pathway would be, it might bump that resistance down a bit as well. Human nature is to say no to things. That's the reality of the matter. And yeah, I'm seeing Lexi saying they might be concerned that like their job won't be needed, which is not true, right? It probably just means that it's the opposite, right? The more that's in the cloud, the more IT infrastructure you'll need and the more training you'll need. So thinking about kind of why they're saying no, and then trying to find a way to get in front of all the different ways they're going to say no. It's a mountain to climb, but I believe it's doable, because I do think that, you guys need this in order to do your mission. And if that's the case, then they should hopefully come on board with you. Sophie, anything you'd add to that?
No, I don't think so. I do have separate comment that I do want to make before we start to close out. I think one of the biggest gifts that I got from transferring from different positions at set timeframes, right? Like when I started my career, I was in AmeriCorps, right? That's a 1-year time frame. And so you're constantly transitioning out. My 2 years in Wyoming was set from the beginning, right? Like, and so I had this opportunity to think from the start of my position, what do I need to make sure I communicate to my successors? What do I make sure I leave this department with so that they can be continue without me and be successful. And I get that that's a scary concept if you are not in a time limited position, right? Like people kind of get a little bit protective of the knowledge that they have because they're like, oh, now I'm like assured to have my job. But we need to approach it with more of a global mindset of, I am not going to be here forever, right? You win the lottery, you get to go on like a grand vacation and like not work ever again. Wonderful. You don't expect that. And we need to make sure you don't want to have to go back and document, 15 years, 30 years of knowledge. You want to start thinking really early about like, what processes do I need to document proactively? And what stories do I need to be telling? And either recording them, writing them down, making sure that they're presented in a way that, to Roberta's point, is productive and not personal, and allow that agency to move forward in your absence.
Great. And I see some communication in the chat. So yeah, feel free to encourage each other. This is what this is for. Anyone else have any final questions before we wrap up? Right. Well, thank you so much, Sophia and Marissa, for facilitating today. I'll turn it back over to Victoria to wrap us up.
Hi, everyone. Thank you so much. That information was so useful. Even I was taking notes on the side. Thank you so much to our presenters. Again, just a few closing reminders. We will be sharing the post-session feedback survey. We'll be emailing that out, and I believe Deloitte will also be dropping it in the chat. And in return, like I've mentioned in the chat, we are recording this call and we will be uploading that to the website along with all of the materials that were shared today. So thank you so much.
And I posted the link in the chat for the survey, so please fill it out. We'd love to get your feedback. Thanks, everyone. Have a great rest of your day.
Thank you.
Thanks, everyone.